Come on, come on. Okay. Good evening, everybody. How are you all? My name is LaShonda. I am a program coordinator here at WomanHeal Incorporated. I'm glad that you all have come to join us tonight. We love to see you all here. We have lots of great information for you guys tonight. Hopefully, the Lord blesses you with, a lot of information and it helps you in your everyday journeys. Um, Tonight's guest star will be the wonderful Miss Jennica. You've seen her at our last financial seminar, and she's also, a huge part of Woman Heal as well. So let's hear it.
Hello, everybody. How are you guys doing? My name is Jennica. I am the Healthy Lifestyle Chair for WomanHeal. And I want to thank you guys all for coming. And today we'll be talking about health insurance. So if you guys don't know, I am a licensed insurance agent. So for about 3 years, I was selling health insurance, and now I'm like on the other end of insurance as a surgical coordinator, where I'm getting basically patients approved for surgery. So basically, after being on both sides of insurance, selling it, and also being the one to help patients get approved for surgeries, I came to realize how many people don't really understand how insurance works, and I feel like at some point in our lives, all of us are going to get insurance. So I wanted to give you as much knowledge as I can from my past 4 years that I've had just dealing with health insurance itself. All right. So if you guys have any questions throughout the seminar, feel free to let me know. Don't be shy. And then let's get started. Okay, so before let's start with the icebreaker. Is anybody are you guys currently insured right now? And if you are insured, can you guarantee that you'll be covered? That's my question to you guys. No? Yes and yes? Okay. All right, perfect. Okay, oh, there's a chat. Yes and yes. Perfect. Okay. All right. So we will for this seminar, we will be standing on four scriptures. The first one is Proverbs 6:6-8. It says, "Go to the ant, O sluggard, and consider her ways and be wise. Without having any chief officer or ruler, she prepares bread in the summer and gathers her food in the harvest." The second one is going to be Proverbs 15:22. And it's without counsel, purposes are disappointed, but in a multitude of counselors, they are established. The third one is 1 Corinthians 6:19-20. Did you not know that your bodies are the temple of the Holy Spirit who is in you, whom you have received from God? You are not your own, and you are bought at a price. Therefore, honor God with your body. And then the fourth one is Luke 14:28. Suppose one wants to build a tower. Once you first sit down and estimate the cost to see if you have enough money to complete it. So from this, we can tell that the Bible is giving us wisdom, not only to take care of our bodies, but also preparing for the future. And being that finances and having a healthy lifestyle are two of the pillars of Women Heal, I felt like the health insurance would basically tie both of those in. So you guys could have as much knowledge as possible when you're making insurance decisions for you and for your family moving forward. Does anybody have any questions so far? No. Now, why is health insurance important? From what I've gathered from the past few years, what I see is from my research as well. Medical bills are one of the leading causes of debt in the U.S. The average cost of a 3-day hospital stay is around 30,000. And then most people do not get health insurance until they need it, and that's when you run into a lot of issues. Also, planning on retirement. I have noticed from selling insurance a lot of the financial responsibility falls on the children, which could be hard because it's like the time you're getting your life together, and now you have to kind of help your parents out um, with those finances. And then let's see. Also, some states do require you to have health insurance by law. And then we're also going to cover like plans for businesses or entrepreneurs that are looking for insurance for their businesses and for their employees at their businesses and for themselves. Also, so you can recognize insurance scams. And then also, many, especially Black women in our community, a lot of them go uninsured because they assume insurance is expensive, but really it's just a lack of knowledge. And we know that without knowledge, people perish. Um, and then and then also we're going to learn what to do outside of open enrollment. So if you're not able to get insurance during the time that you're supposed to do, what you should do. Okay. So here we have a little family. This is Rachel and her family. Okay. Now Rachel, her family came to the US pretty late abroad. And Rachel, around the age of 8 years old, she had an accident, fell and went to the hospital. She ended up staying at the hospital for 10 days, and unfortunately, she was diagnosed with lupus. After the 10-day hospital stay, her bill, the bill came out to $100,000. So now this became just very hard for the family. To Also because they didn't have insurance at the time, not only did they put themselves in debt, but they also did not have that insurance. So they also had to, on top of their bills, have to basically pay additional bills, medical bills and stuff. So it just became hard for the family and stuff like that. Now, since she was diagnosed with lupus, she has her only option is getting a major medical plan. Now, do you guys understand the difference between getting major medical insurance or insurance on the private market? Do you guys know the difference? Sort of. Okay. All right. Perfect. Okay. Now, major medical is health insurance that has to cover all um, five essential needs. And also with major medical, they are not allowed to ask you health questions. So it really wouldn't matter whether you have, let's say you have pneumonia or you have stage four cancer. They're not allowed to search your health history before they approve you for this plan. Now, what is going to be covered with your major medical coverage? This is going to be preventative care, emergency room, urgent care, outpatient, your mental health, lab and tests, prescription drugs, surgery, hospital care. And then why would you need a major medical plan? You have a pre-existing condition. So as I mentioned before, a lot of people don't get insurance until they need it. And then by the time they try to get insurance, these companies are smart. They're not just going to approve you. They're going to try to look at your health history to see if they want you to have insurance with them. Let's see, if you're for pregnancy, for rehab, mental health, substance abuse, or pediatrics. All of these will be covered by major medical, rehab, mental health, substance abuse, and pregnancy, or any pre-existing conditions will not be covered on the private market. Does that make sense? Okay. Now, there are 5 ways that you could get a major medical plan. The first one is going to be employment-based. Second is COBRA. And then we have the Affordable Care Act, Medicaid, and Medicare. Okay. Now, okay, I'm so sorry. I'll get to that point. Okay. So with these plans are also going to have networks. And this basically is like your freedom. So with a PPO, you're going to have access to a larger network of doctors. With HMO, there's only some doctors that you could go to. And with EPO, it's not going to be it. So it's really just networks, and you just have to find if your doctor's in a network. So if you're trying to have more freedom, then you would want to do like a PPO plan or something. With the other plans, you're going to have to wait on your primary to give you referrals, and you can only go to certain doctors within your network. Okay, what else? I'll go back here. Okay. Now, after Rachel's family had the $100,000 bill, they decided, okay, I have to get insurance. So the next thing they did was try to get Medicaid. Now, Medicaid is for low income families. It is offered in all states. You would have to be considered under poverty line, which would be $15,000 or less. And it is different from state to state. And so it's going to be based off your income, or if you're a child, you could get that. Also, I have this, I don't know if you guys can see that. I have this link here, and under this link, it basically has a list of how you could get different ways you could get approved for Medicaid. All right. So Rachel's family basically tried to get approved for Medicaid, but unfortunately weren't able to get approved for Medicaid because both of her parents were making around $80,000. Okay, so they weren't able to approve her for Medicaid, even though she had the lupus. So the next, oh, this was not supposed to happen. Okay, so the next thing they did was go to the Affordable Care Act. Now, the Affordable Care Act used to be known as Obamacare. It's also known as healthcare.gov or the marketplace. And again, this is a major medical plan. They're not allowed to ask for health questions. And the Affordable Care Act is going to be based off your age, your income, and where you live. So again, this is not going to have any limits on care. It's going to give you access to your prescription drugs, and they're not going to ask you about your health. So after trying to get approved for the Affordable Care Act, hold on, I'm sorry guys, I'm literally like, okay. So after trying to get approved for the Affordable Care Act, they ran into basically a few issues. Now, the Affordable Care Act has an open enrollment period, and the open enrollment period is once a year. So that is between the months of December, I believe it's the end of November up to like January 15th. So if you don't get insurance between those months, you will have to wait until a whole new year to get insurance with them. And then it's also going to be, they're also going to calculate your family size and everything. So now what happened with Rachel's family, because the bills became too much, the parents both started working two jobs to basically try to afford their medical bills. Now, even after that, because it shows that they're both making together, making over 100,000, they still weren't even able to get approved for the affordable, even though they got approved for the Affordable Care Act, because they were outside of open enrollment, they were not able to get insurance. And also they were looking at paying probably around $1,300 a month because they both are making over 100,000. Does that make sense, guys? I'm sorry if that's like all over the place. Does that make sense? Okay. I'll just take that as a yes. That makes sense. Okay. Where were we? So also now the Affordable Care Act, I think when I spoke to Sarah, she had a question about this on why the Affordable Care Act, you'll see that it causes a lot of problems like in politics. So again, it's based off your how much you make. So let's say you are in Florida and you are making $25,000 a year. You could get the Affordable Care Act plan for approximately like $0 to $15, where somebody who's making $100,000 a year, they will have to pay $1,000 for the same exact plan. So this has caused a lot of issues in politics because I mean, the more you start making, the more money you make, you're just going to have to pay a higher income. Okay. Um, okay. And then also with all the major medical, well, just insurance in general, you're going to have copays, deductibles, and coinsurance. Now, the copay is basically like the fixed amount that you were going to pay every time you're seeing a doctor. So if you go to a specialist, you might have like a $50 copay, or if you go to your primary, you might have like a $30 copay. And then your deductible is the amount that you would have to pay for the service before your insurance covers the services. And then you have the co-insurance, which is a percentage that you would be sharing with the insurance company. So the company could pay 20%, and then you could be in charge of 80%, something like that. So with that being said, I just have a quick question for you guys, and you guys could write the answer in the chat. So Marlene pays $250 for her health insurance through her employer, and she has never used her insurance before. She has an accident and she basically breaks her leg on the job, and her plan has a $7,000 deductible. Her surgery cost is $25,000. Her co-insurance is 100% until the deductible is met, and her hospital copays are $350. Specialist copays are $30. So before Marlene could have surgery, how much would she have to come out of pocket before her insurance covers it? You guys could write any of these answers in the chat. Oh, that was too quick. Sorry, can you guys? There's, all right, Sarah said C. Sarah said B. This is before she could have surgery. How much would she have to pay? So that's the question. Okay. Don't be shy, guys. You guys can put the answer in the chat. There's like no wrong answers. Well, there is a wrong answer, but okay. So Sarah said A. Kiana said A. Any more answers? Lashana said C. Yeah, this is before having surgery. Abigail said that was too quick. Can you see this on the screen? If you could read it, or I could read it again if you guys want. So the answer would actually be C. So before she could, even if she pays $250 a month for her insurance, before her insurance covers her surgery, she would have to pay $7,000. Kiana, it's okay. Yeah, because it says her co-insurance is 100% before her deductible is met. So she's paying 100% of the bills before her insurance covers it. So yeah, she would have to pay $7,000. Does anybody have questions on that?
So do they reimburse her any of that money, or does she just have to pay that before they'll kick in anything?
She'll have to pay that full $7,000 before they cover anything. So she would pay $7,000. So let's say she goes to the hospital, they'll have the $350 copay, which she'll have to pay at the hospital. But before she could have the surgery, so the $350 copay is just for the hospital. But before she could have that surgery, she would have to pay $7,000. Or they would basically send her a $7,000 bill. So a lot of hospitals will do the surgery, but she'll get a $7,000 bill before her insurance covers it. Does that make sense? No reimbursement. Does anybody have any other questions on that? Okay, so we'll move on. Okay. All right, now, because she wasn't able to get approved for the Affordable Care Act, um, since she was outside of the enrollment period. The next thing she did was go and get employment. Well, the parents went to go to their job to get insurance. Because after starting a new job for 3 months, they will offer you health insurance. Now, with health insurance, it is a major medical plan, but you get it at half the rate because your employer by law is like paying 50% of whatever they're offering you. So the insurance plan could be like $700 a month. You'll be paying like $350 for it because they're paying half off. So they would be getting those same benefits for a more affordable cost. Okay. Now, after some time of Rachel's family working these jobs, they became basically very unhappy with their job because they started to realize the only reason they were staying at their job was because of the affordable health care. And unfortunately, that is a big problem in the US where people who are not in good health will stay at their jobs just because of the health insurance. Because they know if they leave their job and they have a pre-existing condition, they'll probably have to pay over $1,000 at through the Affordable Care Act. So they will stay at their job. Now, so Rachel's dad, he decided to, go out on his own and try to find a new job because he just became miserable working his full-time job. So once he left his full-time job, he was able to get Cobra. Now, Cobra, once you leave your job, okay, and you decide that you want to go somewhere else, by law, your job has to offer you Cobra. So they would be offering you your health insurance that you currently have, but you would be paying full price for it. So where he was paying maybe $350, he would be paying $650. And they will give that to him up to 18 months after he leaves his job. And he could basically leave the Cobra once he finds insurance at another employer or if he gets insurance somewhere else. Does that make sense? All right. So my next question is, does anybody have parents that are approaching the age of 65 or any grandparents that are around that age? Okay.
You said over 85?
65, approaching the age of 65 or over 65 or over. Okay, perfect. All right. So once we all get to, as US citizens, once we all get to the age of 65, we could have Medicare. Now, Medicare is something that as long as you've worked 10 or more years in the United States, you've been paying for it. You probably see it on your W-2 where they're collecting out of your Medicare every single time you get a check. So you're paying towards Medicare as long as you've worked 10 or more years in the United States. Now, Medicare is going to cover 80% of your hospital bills and 80% of your medical bills. Okay. Now, the problem with Medicare is there's the 20% that's going to be left over. Now, what you need to decide is what you're going to do to deal with the 20%. So you basically have three options. You could just stay with Medicare alone once you get it and just pay 20% of every single bill, which could get expensive. Or you could do two different ways. You could get a Medicare supplement, or you could get like a Medicare Advantage plan. Now, these are Rachel's grandparents. So these are her paternal grandparents and her maternal grandparents. Now Rachel's paternal grandparent, Rachel's paternal granddad basically worked in the U.S. Um, and at the age of 65 decided to retire. But he was diagnosed with basically GERD from smoking cigarettes. So when he turned 65, he would have to get like a Medicare supplement plan, which I would get over. Which I would over. Sorry, guys. I'm a little nervous, so I feel like I'm talking too fast. And then let's see, the maternal grandparents, they did not work in the U.S. until, sorry, give me one moment, guys. I just need to, 1 second. All right. All right, so there's two different plans that you could get. The first one is going to be a Medicare supplement, or you could get a Medicare Advantage. Now, the Medicare supplement is what's going to pick up the 20% that Medicare doesn't cover. And then the Medicare Advantage plan, you're basically going to give up your Medicare to an insurance company like Humana or Blue Cross Blue Shield, and then they're going to give you insurance in exchange for it. So now with the Medicare supplement, you could basically go to any doctor you want in the United States. And you will also have insurance if you go outside of the United States. Also with the Medicare supplement, there is a enrollment period, which is 6 months before and 6 months after you turn 65. So as I mentioned, Rachel's grandparent was diagnosed with GERD. So the only way he could get a Medicare supplement once he turns 65 is if he does it in between the open enrollment period of 6 months before and 6 months after he turns 65. Outside of that open enrollment, he can no longer get Medicare because a Medicare supplement, because they would be asking him health questions. Does that make sense? Okay. Also with a Medicare supplement, there's not going to be any cap on coverage. So again, it doesn't matter whether the bill is like $1,000 or $1 million, they're going to have to cover with the Medicare supplement. And then a lot of times with the Medicare supplement, they're not going to have any copays to pay at the doctor. They're just paying their monthly premium, and then they can guarantee that everything else that they need, hospital or medical related, will be covered. Now, the Medicare Advantage plan, this is probably what you've seen. You probably see it on the TV where they're like, hey, call, we'll give you an insurance plan. It's like $0. So you'll get like vision, dental, health. You'll even get like silver sneakers, which is like a gym membership. And they're going to say it was $0. And a lot of our grandparents have this. So what they're doing is they're exchanging their Medicare that they've paid into to an insurance company, and they're going to give them this plan, which is $0, but not really. You've already paid for it your whole life. You're just not paying an additional price on top of it. So with the Medicare Advantage plan, they're not going to ask you health questions. You just have to get it within the open enrollment period. And then you are going to have network restrictions. So before even wanting to have certain surgeries, you're going to have to make sure your doctor approves it. Like for example, right now I have a patient that I'm working with. If he wants to have like a knee replacement, he's going to have to get an approval, and they're going to have to do a bunch of testing, and then they're going to have to fail the test to make sure they could get the knee replacement. Whereas if you get a Medicare supplement, they don't really have to go through all that. They'll just pay for it or whatever. And then with the Medicare Advantage, you're also going to have copays, deductibles, and also the co-insurance when you go to doctors and hospitals and stuff like that. Does that make sense?
Yes. So which one would you recommend?
Well, I would always recommend the Medicare supplement plan. That's always going to be the best plan, but it depends on how like you want to live your life, like the quality of life. So if, let's say your grandparents are not in good health, and they're inside the open enrollment, I'm always going to say a Medicare supplement, because you never know how expensive the hospital bills to get. I would always say a Medicare supplement. It also depends, like let's say you turn 65 and you want to start traveling, that's you would also want a Medicare supplement plan, because like let's say you're somewhere in like Texas and you get a cough and you want to go to the doctor's office, like you could just walk into any doctor's office you want and you know that it's going to be covered. Whereas a Medicare Advantage plan, you might have to call your primary all the way back in Florida and let them know, hey, I want to go to this doctor. And then you have to wait 2 weeks for them to get approval to go see. So it's a whole lot of different processes that you have to go to with Medicare Advantage. And then also, let's say you are not in good health with a Medicare Advantage plan, you're also going to be always paying copays and deductibles every single time if you're somebody who's going to the hospital a lot, which most people that are 65 years old, they are using their insurance. So the Medicare supplement is always going to be your best bet. It could get a little pricey, but it depends on the state that you're in. So let's say you're like in a state like North Carolina or like Kentucky, it's like an extra $100 a month or something like that. But in Florida, you are looking at probably like 200 additional a month for that Medicare supplement. The only thing is like our grandparents or people who are over the age of 65, they're on a fixed income. And that's why a lot of them tend to go to the Medicare Advantage, because if they're only getting paid off Social Security, then it becomes hard to like keep up with that on top of other payments. Things. If that makes sense. Any other questions in regards to the Medicare supplement or Medicare Advantage plan? No. Okay. All right. Now, this is Rachel's brother. So Rachel's brother has grown up now and he is an entrepreneur. He's making money. He's like 28 years old. He makes over $100,000 yearly. He's a single man and he's very healthy. So now he tried to get in, he won't get approved for Medicaid because he makes too much money. He also won't get approved for a subsidy on the Affordable Care Act because he's making over $100,000 a month. So again, he's looking at probably paying $1,200 for a really good insurance, a good insurance plan on the Affordable Care Act. And again, he's an entrepreneur, so he's not making any money. He's not, he won't be able to get any health insurance from his employer. So his other option is to go through the private market. Now, the private market is going to be different from major medical. As I mentioned, major medical, they are not allowed to ask you health questions. So because he is healthy, he could basically call a company like Blue Cross Blue Shield or AARP or something like that and basically get a private insurance plan. So with private insurance plans, there's two different plans that you're going to see. And then this is kind of what a lot of people will kind of get confused because they will think that these plans are major medical when they're not. So the two different plans we'll run into will be indemnity plans and just basically they call it private insurance. Now, indemnity plans, they are called first dollar coverage. And basically you share the responsibility of your plan, of your bills with the insurance company. So it's not like, okay, I go to, with a major medical, I go to the doctor's office, I just have to pay a $40 copay and they will cover the rest. No. With an indemnity plan, they basically will reimburse you for whatever you spend, but they have a limit. So if you see here, there's like an example. So right here, let's say you go to the doctor's office, they will reimburse you after you spend your money, they will reimburse you like $70 for that. And or if you go to emergency room, again, the emergency room bill could be like $1,000. They'll reimburse you $75 for that in emergency room. Or like, let's say you go to you have an ambulance. An ambulance cost, guys, you're looking at over $1,000, but they're going to reimburse you $200 of the $1,000 that you spent. So these are that is an indemnity plan. The pros are there's no deductible to meet. You just pay for the plan and they reimburse you. There's also no enrollment period. So you don't have to wait. Let's say you didn't get insurance when you were supposed to during enrollment through your job or through the Affordable Care Act. This plan, you could call up any insurance company. They're not going to ask you health questions and they're going to give you this plan. The third pro is, I guess, I would say there's no network. So all the doctors are going to approve it. Now, what are the cons? This is a first dollar coverage. Again, it's not catastrophic coverage. So it's just reimbursing you. You can't really depend on this plan if you have an emergency to know that you won't have like $100,000 bill as Rachel did. So I'll give you guys this example. So my company that I work for a doctor office, and this is the plan that they offered me, an indemnity plan. They did not offer me a major medical plan. Okay, so you also, just because you work at it does not mean they have to offer you a major medical. So my company offered me an indemnity plan. Now, one of my coworkers, she wanted to get a breast reduction. So she got a plan from the Affordable Care Act. Now, because she was making probably around, I believe she makes around $30,000 a year. So because she was making that amount, she was able to get an Affordable Care Act plan for around $30 a month. My other coworker, she makes a little bit more. She decided to get an indemnity plan through our employer, and she's paying $200 every pay period for this plan, for this indemnity plan, right? So my other coworker who had it through the Affordable Care Act, when she went to go get her breast reduction, she just had to basically make sure she met her deductible, which she had a $0 deductible. So she ended up paying $150 and was covered for her surgery was completely covered. My other coworker, when she went to have surgery, it was like a $25,000 surgery, and she had the indemnity plan and they paid $5,000 towards her surgery. So she was still left with a $20,000 bill. Does that make sense? Okay. And then also with indemnity plans, you are kind of responsible to track your expenses. So if you don't have a good doctor's office who's doing that, you're going to have to keep calling the insurance company and letting them know, hey, I just spent this X amount and I need you to refund me X amount. So you're going to have to keep track with your bills, and you're going to have to keep calling the insurance company and making sure they're reimbursing you if your primary care doctor is not doing that. Now, this indemnity plan would be a good plan to wrap around other insurances. I personally don't recommend getting this plan alone. I don't know if you guys remembered earlier when I asked you that question about how the employer had $7,000. I'm sorry, she went to go get surgery and she had a $7,000 deductible. If somebody had an indemnity plan, something like this would pick up the $7,000 deductible, so you wouldn't come out of pocket. But this is not an insurance plan that I would recommend getting on your own. So the second plan is going to be private market. So because he did not want an indemnity plan, he decided to go to the private market. Now, the private market, it is going to cover, your copays, your doctor's visit, etc. But again, they're not going to cover rehab, or it's not going to cover pregnancy. So if you are looking to have a baby, you don't want to get a plan on the private market. If you have pre-existing conditions, they're not going to cover you. So you don't want to have an insurance plan on the private market. What I've realized, a lot of people what a lot of people will do is, okay, let's say you go to an urgent care, and then urgent care, there's something wrong with you, and you're just like, okay, you need to have surgery for this. So now what you're just like, okay, I need to have surgery. I need to go call up an insurance company and get this plan. So you call up United Healthcare and you're like, hey, United Healthcare, I need to get a plan. And they ask you all these health questions. You say, no, nope, nope, I'm healthy, I'm healthy, I'm healthy. Now, once it's time to have your surgery, you have to just keep in mind that these insurance companies are still businesses. So what they're going to do is they're going to go through your medical record. They will literally look at the time that you went to the urgent care and they will say, oh, this doctor 2 years ago or like a year ago said you needed to have surgery. So you could be paying for this plan monthly, but when it's time to have the surgery, they will find that report and not cover you. Does that make sense? So if it's been recorded anywhere that you've had like this pre-existing condition or the doctor told you that you had to get this, then yeah, they would not cover you. Also with private insurance, there's a lot of clauses. So it will there's like a list that they will send you and all the insurances are kind of like different. Well, they'll give you a clause that's like, if you went parasailing and you decided to fall off this boat and break your leg, you will not be covered. So you kind of have to go through clauses because all the insurance companies are going to be different. But again, for Rachel's brother who's in good health and does not want to pay $1,200 a month, this would be a good plan to just to make sure he's having like some sort of coverage. And then these plans also have a cap. So again, with major medical, you could say, okay, it doesn't matter if my bill is $1 million, they'll still cover it. With private insurance, they have a cap. So they'll say, we'll cover you up to $1 million. So after your yearly, if you get hospitalized for maybe like a month and you spend over $1 million, we won't cover you after that. So that would be the difference with private insurance. So for somebody, again, who has a business and is young and is healthy, this would be a good plan to be on until it's time to like start a family or something like that. And for an entrepreneur, when it's time to start a family and you want to have kids, then you want to make sure you're getting into like a major medical plan where either through the Affordable Care Act or however you want to get it. Now, let's talk about any questions on that before I go to the next slide.
Yeah, so let's say the entrepreneur is a woman, okay?
Yeah.
She has a family. She makes over $100,000, like our example. So she can't get on like the Affordable Care Act, because she makes too much, etc. Like her only option, and let's say she's pregnant or something like that, right? She gets pregnant. Like, what would be her options then? Because it kind of seems like
She has two options. It's either you're paying full price for that Affordable Care Act plan, or what a lot of employers will do is get group coverage, which is what I'm about to go into the next slide. Now, group coverage is perfect for entrepreneurs as long as you have one or more employees, you could offer group coverage. So with group coverage, you basically get major medical insurance through a company, and they're going to give it to you at a discounted rate because you're doing it as a group. So basically, I know I said before, let's say the plan, like when these employers are offering you a plan, they're getting that as at a discounted rate. So the company will say, because you have 5 people in your group that you're offering coverage through, we're going to give you 50% off these plans monthly. So that's what somebody who is an entrepreneur would want to do. If they don't want to go through the Affordable Care Act, they get coverage through a group. So they could put their kids on there, they could put their employees on there, and they're all getting it at a discounted rate. Does that make sense? Does that answer your question?
yeah, I mean, I guess that makes sense if she has employees, but I'm just thinking like, I don't know what that she would do.
One or more employees. Yeah,
Yeah, I
even
guess
if you just have one person under you, you could do group insurance.
okay.
Yeah, so it's either that, or if you want to have the baby, you would have to go through the Affordable Care Act. Yeah. Now what are the other benefits of getting group coverage? Um, when you're filing your taxes, the government, of course, they're going to want some money. So this is going to be a good way to write off um a lot of expenses off your taxes. So a lot of employers will do that for tax purposes, and again, because they're getting a discounted rate the minute it's a group rate. And then, of course, another option was to increase employee satisfaction and making sure that you are getting a good retention rate. Because again, a lot of people in the US stay at their jobs because of insurance. So a lot of companies, they want to offer these benefits, whether it's like PTO, whether it's health insurance. So a lot of companies will provide the health insurance for that reason. Okay. And then now, once you do get to the point where you are having 50 or more employees, by law, like legally, you have to give insurance if you have 50 or more employees. Any questions on that? All right. Okay. All right. Well, then my last question would be, um, maybe you guys could just give me like an example. Anybody, like, why would you choose a major medical over a private insurance, or and vice versa? Why would you pay a private insurance over major medical? You guys could just give an example. I just want to see if you learned anything. Anybody?
Well, major medical, I believe, if I'm remembering correctly, it would be more beneficial than private insurance if you have a pre-existing condition, because then you'll be covered and they won't look at your history. But if you have private insurance, or if you're trying to apply for private insurance, they're gonna look at um whatever your history is, and maybe you wouldn't get approved. Oh,
Correct.
and he says more coverage.
Yes. Well, as in there's certain like rehab and stuff like that, they can't. Correct. Like if let's say your son has like wants to go through rehab or something, yeah, that would go through major medical. And then like vice versa, why would you pick private insurance over major medical? Well, better doctors, no. Actually, no. So, you'd be surprised, but you actually would get better doctors through the private market. And why is that? So, private market is going to be all PPO, mostly PPOs, or meaning they're not going to be restricted to a network. Now, as I mentioned earlier, the Affordable Care Act is something that is through the government. Whenever you're dealing with the government, it's very regulated. So these doctors are actually not getting paid as much as they were when they were as much as they would through if they were to go through a private market. A private market plan is going to pay them right away. The Affordable Care Act is actually taking a year or over a year to pay these doctors back. So you will be a network. So with the like for the Affordable Care Act and stuff like that, sorry, I just like lost my train of thought. With the Affordable Care Act, there's a lot of companies, insurances, I'm sorry, a lot of doctors and hospitals that actually decide not to go through the Affordable Care Act because they're not getting paid right away. But let's say if it was something through your job, then yes, you'll probably find better networks. But through the Affordable Care Act, there's a lot of doctors that choose not to do that. Any other questions?
Yes, so I have a question that's not exactly pertaining to this slide, But you mentioned that to get Medicare after 65, you had to work in America for 10 years. So if you were like self-employed, as long as you're paying taxes, that counts? Or does it have to be specifically taxes towards Medicare?
Yeah, so if you are self-employed, you would have to be paying your taxes towards Medicare at the end of the year to automatically get it. Or when you turn 65, you would have to pay full price for Medicare. So what I've seen a lot with a lot of like my patients, a lot of the husbands will work and then their wives will be stay-at-home wives. Now, once they turn 65, I've had like a case where like their husband passes away and their husband is no longer able to provide in a way, and they were always stay-at-home wives. Because they have not worked 10 or more years in the United States or have not paid into Medicare, they will be they will have to pay full price for Medicare, which is like around $1,000 a month.
Okay, so what about if there's an older couple
Mm-hmm.
and let's say the husband worked for 10 or plus years and maybe the wife only worked 5, let's say.
Mm-hmm.
Are there plans where like the husband can carry his family under it, like a family plan type of thing where his wife could be
For
in?
Medicare, no. The only time you'll see something like that is if you have retirement plans where like group coverages will give you retirement plans, which you could carry after the age of 65. But with Medicare, no, it's stand on your own. There's no more family coverage. Once you turn 65, you are on your own. So again, that option would either be to either A, pay into Medicare at the end of the year for about 10 years, or you pay full price once you turn 65. And again, right now, I know like full price for Medicare is over $700 for both Plan A and Plan B. So I don't know how much that will be when we get 65. I don't know, but you're probably looking at way more. If that makes sense. Um, Kiana asked me, have I heard about Medi-Cal? Yes, I have heard about Medi-Cal. Medi-Cal is also known as the Affordable Care Act or the Obamacare. That is now that with Medi-Cal, with California, that is a state where by law you have to have insurance or you get taxed heavily. I know it's California and also New Jersey and forgot the other state, but I think I wrote it in here. Um, but yeah, so Medi-Cal would be like the Affordable Care Act. And it is major medical coverage. Is that what you have, Tiana? Yeah, I mean, at least you have coverage. That's good. Oh yeah, Kaiser. That's good. Again, but you do have restrictions on which doctors that you could go to, right? You can only go to certain doctors and you have to be in certain networks with Kaiser. Like yeah, you can only go to Kaiser doctors. Any other questions? All right. Well, my last tip would be when you're kind of looking through insurance, it kind of really doesn't matter on the company. Um, I mean, of course, the only difference with these companies is going to be financial backing, meaning how long have they been in business and how much money they have in the bank. That's really the only difference. But by law, they're all going to fall under one of these categories, and they're all basically going to have the same plan no matter what. So the best thing is just going to make sure you're having like a low deductible, and that's what's going to protect you and making sure you have a major medical plan. Guys, if you don't have any questions, I think that would be it.